check this out. One more question. Now, this question, I don't know about you, but I see something like this, it freaks me out, especially if you do a time test. You're like, you know what? There's a long scenario, a lot to look at. Either A, you attack it when it's a time test, or B, and just a disclaimer, this could be psych, pharm, biostats, whatever you do not, medical ethics, whatever you don't want to do, flag it and jump over it and move. Because on a timed exam, if you allow a question to eat up your time, destroy you mentally, mess you up, make you second guess, you'll lose, you won't do well. Because if you allow the question to chew you up, think of the other questions you're going to attack in that block. It's going to be frustrating. So a quick tip, jump over any question that you don't want to attack. If you're doing a time test, attack it at the end of the block. And I promise you'll do a lot better. All right, check this out. Peripheral blood smear shows erythrocytes of unequal sizes. Read the last 2 lines usually, right? Practice this technique. And I hope you know, a technique takes time to master. A skill, you don't learn how to play tennis overnight. You don't know how to play basketball overnight. You can't do questions within a couple of days and pass the test. That's why we usually do 1 Qbank. That's what we usually answer thousands of questions. The more you practice, the more you see patients. That's why med school is 4 years, residency is 3+. You have to keep practicing to get good at it, right? So read the last 2 lines, 3 lines always. Peripheral blood smear shows this. Which of the following is the most likely? Which of the following is the most appropriate next step in evaluation? All right, go to the labs. Hemoglobin, high or low? Low. You don't know? It's okay. Open up the labs. Don't worry about it, guys. We have family. We have team. Hemoglobin, females 12. She's a girl. That's low, right? Erythrocyte count. Who really cares at this point? But here you go. So 3.5. This is 3.7. 3.5 to 5. Okay, normal. MCV, high, medium, or low. This is 74. We know 80 and below is microcytic. 100 and above is macrocytic. This is low. Highlight left. Leukocytes. Look at leukocytes. 4,500 to 11,000. 4,500 to 11,000. Normal. Platelets. Don't worry. Look at it. Boom. Normal, right? Okay. Red count. 0.5 to 1.5. A little low, right? TSH. Go back to the blood. You could always type in TSH here. TSH. It'll pop up. You type in thyroid. Usually pops up. Let's see. Does it pop here? There's thyroid. There's TSH. 0.4 to 4 point. 0.4 to 4 point. This is normal. Okay. So, ladies and gentlemen, those who are still here, and again, it's 8 to 9, but we go over it when we can. Why not? We're a team. If I can add more time, I will. By knowing the MCV being less than 80, can we knock out a few answer choices, guys? Yes. You know what we can knock out? The macrocytic. What do you see here that are macrocytic? B12. Out. I mean, yeah, right? That's kind of cool. All right. So now you have hemoglobin electrophoresis, direct Coombs test, ferritin levels, bone marrow biopsy. Okay, fair. So we're able to take out 1 or 2 sometimes, even more. Let's go to the top. 17-year-old girl comes to you for a 4-month history of fatigue. She had infectious mono 8 weeks ago. Menses are regular at 28-day intervals, last 5 days, moderate flow. Her last menstrual period 3 weeks ago. Her mother has Hashimoto thyroiditis. Examination shows pale conjunctiva and scaling of the corners of her mouth. The remainder of the exam shows no abnormalities. Lab shows studies below. Okay, so now when you do this information, top to bottom, we're able to read the question, right? We were able to read the scenario. Okay, we're able to get some information clearly in the lab values here. Sure. So now what do we do next? Well, may I ask you a question? Erythrocytes of unequal sizes. What does that mean? Any indication? Well, either A, you can knock out the answers and go, meaning you have the answer and you move. Clearly, if you know how to answer the question, read the scenario, something pops up, boom, click, and move. The other approach, as we're doing now, we're eliminating, because if I help you learn how to eliminate, then you become a better test taker. And also increase your knowledge, right? Strengthen your knowledge. So we took out C. Why? Because C is B12. B12 is macrocytic. Macrocytic is MCV over 100. This is 74. Question, ladies and gentlemen. Hemoglobin electrophoresis usually is abnormal when we have sickle cell anemia and beta thal. Okay. If it was sickle cell, what would you see here? I mean, you would see something different, would you not? Yes. So because of that, we take out this one. Boom. Now we have direct Coombs test, ferritin levels, bone marrow biopsy. What else can we take out, ladies and gentlemen? Do you think we need to do a biopsy of the bone marrow for a young female who is anemic, who most likely is microcytic anemia because it's less than 80? She is fatigued. I mean, this sounds like many things. It could be iron deficiency anemia. We're not exactly sure. But if that's the case, I mean, you can either hit the answer. You could say, well, ferritin levels looks to me like the most common answer because the girl is young, she's tired, fatigued, she's anemic, MCV is less than 80. That's fair. Yeah, 100%. Here, this is the answer. But why is 70%? Why only 70% chose this? It should be 99%. No, it should be 99%, not 70%. So if you know that if you highlight the information, be able to understand how to differentiate, you could either say, you know what, it looks like iron deficiency anemia to me, iron deficiency, cool. But if you don't have the connection because your test is long, you're tired, you're exhausted, this is block number 6 or 7 on your exam day, and you're really tired, you have to be able to have the power to eliminate the other answer choices. Bone marrow biopsy, well, I mean, it's used to diagnose what? Aplastic anemia and other things like malignant blood malignancies, right? Not really used for iron deficiency anemia, right? And then it says, what is the following is the most appropriate next step in evaluation? So by reading the last 2-3 lines immediately, right? Then by reading the whole scenario, you're able to read the last 2 lines not only once, but twice. You have to know what they're asking of you. And to answer a question I just got, do we need to memorize lab values or will it be provided? No, you don't have to memorize the lab values. The lab values here are also provided just similar to this on the actual exam. So when you do more questions, you can get comfortable with different lab values. That's all. You don't have to memorize any lab values. If it's not in the lab value section, they will actually put the normal values range in the question stem. So you don't have to memorize that completely. All right. So going back to this, B12 was out because it's macrocytic. Hemoglobin's out because sickle cell. This is not sickling and not beta thal. Bone marrow biopsy, yeah, but that'll be pancytopenia and to do a biopsy on a patient that's anemic. For right now, unless you thought it was a malignancy, it's not. So this is out. And then direct Coombs test, I promise you, you do not need to understand this in full detail. If you want to learn it, there's a nice picture here. You can review this. When I was taking the test 15 plus years ago, we had to memorize this. We had to learn this inside and out. They loved asking questions about this in my time, not anymore. All you need to know is this is affiliated with AIHA. AIHA, ladies and gentlemen, is an example of what hypersensitivity? Type 1, type 2, type 3, type 4. Now there's a connection between immunology and HemOnc, right? You see? So I know some of you jumped on for the first time today or yesterday. Starting next week, we'll start doing week 1 again, which is immunology. But until then, a quick question. Is it type 1, 2, 3, 4? Dr. M, Dr. Kaloga goes, yo, man, type 2. You're right. Autoimmune hemolytic anemia is a type 2. So all I want you to know is direct Coombs test is affiliated with AIHA for now. As you keep practicing more and more and more, if you feel like you want to know what direct Coombs test is, you can, but it's not worth the sweat equity. Clearly, they're not going to ask you questions about this. They just won't anymore. But knowing AIHA is a type 2, and before we go, I'm going to show you this, because show you how crazy this gets and how easy it's going to become. Here, I typed in AIHA. It's only in a few pages. Here it is. Ready? And actually, it should be in other ones, but I'll show you this. Watch. We're going to go into Coombs test, and there it is. Type 2 hypersensitivity. We'll do this next week. We do immuno, so don't worry. But this is what I need you to do. I need you to know these examples. So you don't have to memorize them now. Dr. K didn't memorize them. He was like, hey, man, I've been on your sessions every week. And I realized by repetition, I'm able to make the connection. So this is what USMLE does. They make you believe one thing and they flip you somewhere else. So you know about AIHA, but you forgot. I didn't know what type it was. You knew all this. You knew about all this. You knew about the stupid AIHA, but you did not know that it was actually a type 2. And that's why this test makes us all feel stupid sometimes, but it's okay. I'll do my very best to teach you everything, right? Step by step by step. So that's why when you do questions like this, using a PDF like that is very beneficial because you're able to jump around to learn a lot more. But it does take time. That's why you can't just study one thing. You got to keep studying and studying and studying and studying, and eventually things connect, okay? So something like this, when you are reviewing information, I want you to understand that seeing tricks like this help you differentiate things. But if this is a new thing for you, hematology, oncology, take your time. If this is brand new or you haven't studied in a while, I would suggest 3 to 4 to 5 days of, if you have to watch videos, using the Qbank, using the first aid, do focus training, and then move on to another organ system, and eventually things will come back into cycling, all right?